to touch briefly on this, we know that there's some interaction too between migraine medications and how they affect the gut. Are there certain migraine treatments that are easier on the gut, or are there certain migraine medications that are making things worse for the gut? Can you just speak to that briefly?
Sure, Wendy, absolutely. One of the hallmark treatments for migraine prevention for decades has been a tricyclic medication. And if you're not familiar with those, that's like amitriptyline or nortriptyline for those listening in. Now, those medicines have been around forever. Here's what's cool about those medicines. Those medicines not only reduce nerve irritability to help with gut health and migraine, but they also, in some of them, have the ability to reduce the inflammatory effects in the gut. Some of them even stabilize those same mast cells that we are talking about. So sometimes it's a good thing to have that type of medicine around. However, we don't need gigantic doses because a lot of our patients who've been on those before might recognize there are side effects to those medicines. For some people, waking and fatigue, but for some people, slowing down of the gut and constipation, which is just not cool. So there's a balancing act between those, but tricyclic medicines have been quite effective for our folks who've got a gut health relationship to the migraine that's a bit more problematic. And I'd ask your listeners to kind of follow up with their physicians to ask about if that might be an option for them. The next thing is our CGRP targeted therapies, and specifically our CGRP targeted therapies that target the receptor itself. Those medicines have a side effect of constipation in some patients, and sometimes it's not subtle. Sometimes that's a pretty profound, I can't go to the bathroom since I started this medication. And those are concerns for us because we don't want to disrupt someone's gut health to the point it's causing trouble. But that goes again to that discussion that CGRP is in our gut health and we can affect it using medicines that target CGRP.
So just use other types of medications that don't go after the receptor. Is that what you're saying?
Yeah, I mean, there's ways around that. Sometimes those medicines are very effective and can be helpful in stabilizing the gut, but be aware that some of those medicines also have a consequence of causing trouble too. And those are things to kind of pilot through and seek guidance through your provider.